Dr. Aruja, GANGWANI.
Good morning, everyone. I'll be presenting my paper on indigenous ruthenium plaque brachytherapy for ocular tumors, experience from a tertiary care center. So plaque brachytherapy is a form of local radiation that is delivered to the eye via radioactive device, with the most commonly used ophthalmic plaques being iodine-125 and ruthenium-106. The BARC has recently introduced the indigenous plaque to make plaque brachytherapy treatment affordable and available in India. So we report our experience with the use of this indigenously developed ruthenium plaque in the management of ocular tumors. So we conducted a retrospective review of the clinical records of the ocular tumor cases treated with the plaque brachytherapy at our center. The plaque that was used was indigenously developed in collaboration with BARC Mumbai. Demographic information, clinical details, and radiation dosimetry of the cases that were treated with plaque brachytherapy were noted and analyzed. So we did a complete preoperative evaluation of the type of tumor, the size and location of the tumor by clinical examination and imaging. And we had two ruthenium plaques. One was a notch plaque, the other was a round plaque of varying diameters that we used for our study. We gave local and general anesthesia depending on the age of the patient. Peritomy was done, the plaque was positioned, and the radiation was delivered for the predefined period. And subsequently, the plaque was removed. So we identified a total of 47 cases that have been treated with indigenous ruthenium plaque brachytherapy between the years 21 to 23. The mean age was 27.5 years, and we treated both pediatric patients with age ranging from around 9 months to adult patients to age almost around 70 years. We treated both benign and malignant tumors. So coming to the most common indications for treatment with indigenous ruthenium plaque brachytherapy, choroidal melanoma accounted for maximum of our patients, followed by retinoblastoma. We also treated other tumors like choroidal hemangioma, OSSN, VPT. So coming to the mean apical thickness of the tumors that we treated, it ranged from around 1.45 mm in OSSN to around 5.59 mm in choroidal melanomas, with the mean duration of application ranging from around 8.2 hours to around 60 hours. The mean dose ranged from 62 grays to around 321 grays. So all the cases were effectively treated with the use of indigenous plaque, thereby showing its utility in a wide range of benign as well as malignant lesions of the eye. So the key points that I would like to highlight is that we treated both benign and malignant tumors. We treated both pediatric and adult tumors and tumors of varying thickness. So previously we have indigenously developed I-125 Ocuprosta seeds which have been used for plaque brachytherapy for various intraocular tumors. And these seeds offered a viable option for the management of intraocular tumors. However, iodine is a gamma emitter while ruthenium is a beta emitter. Ruthenium is preferred because the radiation gradient surrounding the ruthenium plaque is steeper than that found with the gamma emitter. Also, ruthenium is a cost-effective alternative as it has a longer half-life, and the same plaque can be reused for a large number of patients as its shelf life is more than a year. Thus, the ruthenium plaque is actually a cost-effective alternative. I would like to conclude by saying that plaque brachytherapy can be used for many different types of ocular tumors. The indigenously developed ruthenium plaque was found to be promising in a wide variety of malignant as well as benign tumors of the eye and ocular surface in both adults and children. And it offers an effective and inexpensive alternative to the imported plaque, particularly for use in clinical settings with limited resources. Thank you.
No, I think it was well presented. Thank you.
The next speaker, Dr. Abha Gupta, are you there? Yeah. What is the rationale for giving toxic drugs in a benign tumor? Dr. Aruja, can you answer that? Has she gone? Use that. Use that.
Larger in size and had associated large exudative retinal detachment and were not amenable to TTT. So in those cases, we have used plaque brachytherapy.
Okay. Thank you.